Hello and welcome to Healthy Lifestyle Tips. Today, we're going to discuss the top 10 early warning signs of colon cancer. Colon cancer, also known as colorectal cancer, is a type of cancer that develops in the colon or rectum. It's the third most common type of cancer in both men and women, and early detection is key to successful treatment. So, let's dive into the top 10 early warning signs of colon cancer. 1. Changes in bowel habits. Changes in bowel habits can be one of the most common early warning signs of colon cancer. Bowel habits are the normal pattern of bowel movements that an individual experiences. Changes in bowel habits can include an increase or decrease in frequency, consistency, or size of stools. While changes in bowel habits can be caused by many factors such as stress, diet, or medication, they can also be a symptom of colon cancer. Persistent diarrhea or constipation can indicate a problem with the colon or rectum. These symptoms can be caused by a tumor growing in the colon or rectum, which can lead to a partial or complete blockage of the bowel. This blockage can make it difficult for stool to pass through the colon and rectum, leading to changes in bowel habits. Another change in bowel habits that can indicate colon cancer is a change in the size and shape of the stool. If you notice that your stool is thinner or narrower than usual, it could be a sign of a blockage in the colon or rectum caused by a tumor. This change in size and shape can be due to the tumor growing and narrowing the space through which stool can pass. It's important to note that changes in bowel habits can also be caused by other conditions such as irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, or infections. However, if these symptoms persist or are accompanied by other symptoms such as blood in the stool, abdominal pain, or unintended weight loss, it's important to talk to your doctor to rule out the possibility of colon cancer. 2. Blood in stool. Seeing blood in your stool or on the toilet paper after wiping can be a sign of colon cancer, but it can also be caused by other factors such as hemorrhoids or anal fissures. It's important to note that not all cases of blood in the stool are due to colon cancer, but it's still important to take this symptom seriously and discuss it with your doctor. If you do notice blood in your stool, it may appear as bright red or dark depending on where the bleeding is occurring. Bright red blood in the stool typically indicates bleeding from the lower part of the colon or rectum, while dark or tarry stool can indicate bleeding higher up in the digestive tract. It's important to note that not all colon cancers bleed, so the absence of blood in the stool does not necessarily mean that you do not have colon cancer. However, if you do experience blood in your stool, it's important to talk to your doctor immediately to determine the cause and undergo appropriate testing and screening. 3. Abdominal pain and discomfort. If you experience abdominal pain, cramping, bloating, or discomfort that lasts for an extended period, it could be a warning sign of colon cancer. This pain can be caused by a tumor in the colon or rectum that is growing and pushing against other organs. 4. Fatigue and weakness. If you feel constantly tired and weak, it could be a symptom of colon cancer. Cancer cells use up a lot of the body's energy, leading to fatigue. This can be especially noticeable if you feel tired even after getting enough rest or if you experience a lack of energy throughout the day. 5. Unintended weight loss. Losing weight without trying could be a sign of colon cancer. When cancer cells grow, they can cause a loss of appetite and a decrease in weight. If you notice that you're losing weight without making any changes to your diet or exercise routine, it's important to talk to your doctor. 6. Anemia. Colon cancer can cause chronic bleeding in the digestive tract, which can lead to iron deficiency anemia. Symptoms of anemia include fatigue, weakness, and pale skin. If you're experiencing any of these symptoms, it's important to talk to your doctor about getting tested for anemia. 7. Rectal bleeding. If you notice blood on your underwear or toilet bowl after a bowel movement, it could be a sign of colon cancer. This can be caused by bleeding in the rectum or colon due to a tumor. 8. Bowel obstruction. A tumor in the colon can cause a partial or complete blockage of the bowel, which can lead to symptoms such as abdominal pain, bloating, and constipation. If you're experiencing these symptoms, it's important to talk to your doctor immediately as bowel obstruction can be a medical emergency. 9. Nausea and vomiting. Colon cancer can cause nausea and vomiting due to the blockage of the bowel. If you're experiencing these symptoms, it's important to talk to your doctor to determine the cause. 10. Family history. If you have a family history of colon cancer, you may be at an increased risk of developing the disease. It's important to talk to your doctor about screening options if you have a family history of colon cancer. If you're experiencing any of these early warning signs of colon cancer, it's important to talk to your doctor immediately. Early detection can make a huge difference in successful treatment and can increase the chances of survival. Colon cancer is treatable and preventable, so maintaining a healthy lifestyle with a balanced diet and regular exercise is important in reducing your risk of developing this disease. In addition, getting screened for colon cancer is crucial, especially if you're over 50 or have a family history of the disease. Screening tests, such as colonoscopies, can help detect precancerous polyps or early-stage colon cancer before symptoms even appear. The American Cancer Society recommends that adults begin regular colon cancer screening at age 45, and earlier if they have a family history or other risk factors. In summary, the top 10 early warning signs of colon cancer include changes in bowel habits, blood in stool, abdominal pain and discomfort, fatigue and weakness, unintended weight loss, anemia, rectal bleeding, bowel obstruction, nausea and vomiting, and family history. If you're experiencing any of these symptoms, it's important to talk to your doctor immediately and get screened for colon cancer. Thank you for watching this video on the top 10 early warning signs of colon cancer. If you found this information helpful, please give this video a thumbs up and don't forget to subscribe to Healthy Lifestyle Tips for more health and wellness content. Also, if you have any questions or concerns about colon cancer or any other health topic, please leave a comment below and we'll do our best to provide you with the information you need.